Hi, for my first video I'm going to be doing some lab maintenance. A lot of our lab equipment we have the providers such as VetScan and Abaxis come in. Actual maintenance people come and do a lot of our maintenance, but for the most part, daily wise maintenance that we do, you come in the morning and for every 24 hours we have to run a blank. So since it's later in the day, a blank has already been ran, but what a blank does, it goes and runs the machine without any blood sample to make sure that all of the settings are correct and that everything equals out and there's no weird reading. So you'd go to measure and it would automatically pop up, and so it'd be a screen like this and you'd hit run and it'd be running a blank. So for example, blank. And it would pop up with anything like that. So next thing that we do, reagent pack. If it's running low and it's almost empty, we go down below here and then we would replace this here. This is all the reagent liquids for the machine. And then we run our blank. So then maintenance wise, for cleaning, what we do a lot is washing the head. So the head is the part that goes and actually collects the sample. So to hit next, and then the machine prepares the head and moves it around so that I'm able to clean it. And I use some Kimtech paper, some really good paper that we use for like our microscope and things like that. And we go ahead and we clean the wash head. We want to use this type of paper so it doesn't leave any lint behind. So we'll continue to do that. And then also we have different settings for different sizes of blood vials that we may need. But overall, for all of our machines, we have the professionals come in and do the deeper cleaning and quality control. So now that the head is moving into position, alright, so we are going to open up this door to the side. Alright, and then the wash head is inside the machine here. So I'll go ahead and clean the wash head. Typically the wash head's not super dirty because we do it regularly. Just like so, and then hit done. Now I'm going to be showing how to do an ELISA test. So we're going to be doing a heartworm test. So what we have here is our canine heartworm antigen test kit. And I'm going to be using a sample from a patient named Bernie, and his heartworm test was drawn up using a heparin needle. So his blood is anticoagulated. So what you do, take the test out, and I already labeled Bernie, and we do 1 drop of the sample. And we let it sit there and soak for about 3 to 5 seconds. And then we take our buffer that is provided with our antigen test, and we do 2 drops of the buffer. Okay, and then we note the time is 14:40, and we let that sit for 10 minutes. And you want to read. So now we have a result for our antigen heartworm test. As you see, Bernie is not positive. So we'll go ahead and now I'm going to be showing how to do a modified Knott's test. The reason why you'd want to do a modified Knott's test is that it concentrates microfilaria, and then also helps differentiate between the dirofilaria and the dipatelonema filaria as well. So what you'll need is we have our 2% formalin liquid here, and you do 9 mils of it. So we'll go ahead, put the 9 mils. And then some anticoagulated blood. So this was drawn from a 3 ml lavender top tube. So we'll go ahead and add our 1 ml of blood here. And then we're going to put our cap back on. We'll invert it a couple times gently. And then now I'm going to go to our centrifuge, and we have our counterbalance. Make sure it's properly countered. I have counterbalance over here. And then we're going to be running it for 5 minutes at 1500 speed. And we'll go ahead and start it. So it's been 5 minutes now, so I'm going to go ahead and open up our centrifuge. Pour off the top part of it. Careful not to disturb the sediment at the bottom. And add a drop of our methylene blue. 1 drop. We'll go ahead and mix it with our pipette here. So we have that. Close the lid. And we'll add 1 drop onto our slide here. We'll go ahead and add our cover slip here. Okay. And we will go ahead and place it on our microscope. We'll go ahead and take a look at it and review our results. One more. Okay. No microfilaria present. And that's how you do a modified knots test. Now I'll be showing how to do direct smear. So what you'll need is a cotton tip applicator. Take the wooden piece here and collect a small sample such as that. And we grabbed it from our fecalizer here. And then we have our slide here, our saline. Do a drop of saline on our slide here. And then we are going to tap it to get the fecal sample on there, but you don't want to make it too thick so that you can't see through it, just like so. And then go ahead and put a cover slip right over the top, and that is how you do direct smear. So after preparing the direct smear, I took a look underneath underneath the microscope, and everything looks normal for our patient Josie. Why you'd want to do a direct smear versus other ones is that direct smears are nice and fast, and you don't have to use very many materials, as you saw, and it helps detect eggs and larvae, and also other parasites such as Giardia. So that was our results for our direct smear. Now I'm going to be showing how to do a fecal flotation. What you'd be doing a fecal flotation, what you would see is the parasite ovas and the eggs, because the solution for it, what we use, fecal sol, changes the specific gravity, and so the ovas and the eggs will float to the top and then stick to your cover slip, and that's how you'd be able to see it. You don't necessarily see larvae or anything like that. So without further ado, I'll go ahead. I've got 30 mils of my fecal sol already prepared. And then also we'll have my fecal itself that's been collected. We'll grab some of that. Go ahead and let's place it to our sample here. And what about 3 to 5 grams of fecal matter, approximately. Okay, place that back from our patient Josie. And now we're going to add our fecal sol into our waxed paper cup. And then we're going to break up the bits here and mix the solution. We want to break up the pieces because something like this could hold those eggs. And then, looks like that. Now, we're going to go ahead and transfer it over using our filter here. Just like so. To another cup. And then we're going to place this into our 15 ml vial. And we want to fill it up as much as possible to get a nice bubbled edge there. And that's a little much, so I'm going to pour a tiny bit off. Perfect. And now we're going to place this here. Add a cover slip to the top, just like so. And now all those eggs and ovas are going to float to the top and stick to that cover slip, and we'll let that sit for about 20 minutes. So now our fecal float is has been sitting for about 20 minutes, and you can see it settling there. So we'll go ahead and take our cover slip off and place it right on top of our slide, and then we'll go ahead and read it. So after analyzing our slide from our flotation for our fecal sample, everything looked normal and there was no parasites present. Now I'm going to be showing how to do a fecal centrifugation with flotation. So it's very similar to the fecal flotation, except we're going to be spinning it down with our centrifuge. So we'll prepare it with our fecal sol. So fecal sol is going to change the specific gravity. It's a sodium-based product. We're going to be doing 30 mils with approximately 3 grams or so of fecal matter. So again, like the flotation, it's going to be showing cysts and eggs and things like that, ovas, except it's just going to be doing it in a shorter amount of time instead of about 20 minutes. So we'll go ahead, grab our fecal matter from our patient named Josie. Go ahead and grab some here into our waxed cups, just like so. Add our 30 mils of solution. And we'll go ahead and mix it, breaking up the big chunks of fecal matter. And mix it thoroughly, just like so. And then using our filter here, going to filter it into another cup, just like so. And then we're going to go over to our centrifuge machine. We're going to be spinning it at 1300 for 6 minutes. And enter it. I already have a counterbalance placed. We'll go ahead and pour our solution into our vial. And we want to have a nice little bubble at the top there to place our cover slip. Just like so. And then we're going to place our cover slip just like so. Okay. And the cover slip's going to keep the solution from coming out. And we'll kind of vacuum seal it to the top so it doesn't fall off. We'll go ahead and close it, and we'll spin that for 6 minutes. Alright, so now that our flotation has been spun in our centrifuge, I'm going to go ahead and take that cover slip off and place it on our slide here, and then we're going to go ahead and go read it. So after analyzing our slide from our centrifugation flotation, everything looked normal, a couple bits of plant matter, no parasites present. Now I'll be showing how to do a fecal sedimentation. So we have our patient Josie's fecal here. We'll go ahead and place about 3 grams of fecal matter into a cup here. Okay. And then we have some water here. We're going to add about 30 mils of it. To our sample. Okay, 30 mils have been added. We'll go ahead and mix the fecal matter into the water. Make sure it mixes nice and well. Okay, and now we are going to filter it into another cup here. Okay. Alrighty. And then we're going to add it into our 50 ml vial here. And then we are going to add more of our water here to our vial. To about 50 mils. And then we're going to let this sit for 15 to 30 minutes. So it's been 15 minutes, so now what we're going to do is going to be pouring off all of this excess liquid here, leaving that sediment down below at the bottom. So we're going to go ahead and pour this. Trying not to disturb the sediment. Okay. And now we're going to go ahead with our water and fill it up again to our 50 ml mark, just like so. And then we're going to let all of that float down to the bottom again, and we're going to be doing this twice. I won't show the second time just because it's the exact same as this for what I just did. The reason why we're so thorough with this is that fluke, the parasitic fluke, is really heavy and it sticks to the bottom. So doing this washing out of anything excess will help reveal those flukes. So we'll go ahead and let this sit for another 15 minutes, and then I'll go ahead and do this again, and then we'll continue on. So we did our third time of removing the water and then placing more water back in. So now we are ready to remove all of this water and then just have that sediment down at the bottom, trying to leave it undisturbed. So we'll go ahead, remove it little by little. And as you see, it got a lot more diluted compared to the first time we did this. So then, once we get down to that sediment, we're going to place it on the slide, place a cover slip on top of it, and read it under the microscope. And so we will do that multiple times as well, so that we can get all that sediment at that bottom there. Okay. All right. So here we go. And now we're going to mix it around. And I'm going to place it into a different cup here so it's a little bit easier to grab of our sediment. which is not ideal, but we don't quite have a large enough pipette to go all the way down at the bottom. So go ahead and place 1 drop of sediment there. And so as you see, we would eventually get down to all of those and read every single one of them, because flukes are kind of tricky to get to. So place our cover slip, and we'll go ahead and read it. Alright, so we took a look at all of our sediment that we did, and we did not see anything on there, so no flukes present, and so that is how you do a sedimentation for a fecal test. Now I'm going to show how to do an ear cytology. I'm going to go ahead and grab my sample with my swab here. This is Courtney, she's one of my coworkers, she's going to help restrain. And this is Finn, my preceptor's dog. So I'm going to be taking from the left ear. He's not currently showing symptoms, but when we would do an ear cytology is if a dog was pawing, scratching, rubbing their face against the floor, redness, a smell coming from their ear, something like that, that could be yeast or something else. Imagination, we're imagining that Finn has a very inflamed left ear that kind of smells bad, so we're going to go ahead and grab a sample. So just lift up her ear. He's got lots of hair. So move away his hair, and then you want to make sure that you get into the canal. As you see, he actually does have some goopy ears. So we'll stick it in, and go ahead into the ear canal, grab some stuff out of there. Alright, so I got some things, and now we're going to put it on a slide. We're going to roll it on there. Dry and crusty, not super waxy. But there we go. And I can't really see it that well. There are cells on there, and that'll definitely pop up when we go to stain our slide. Now we are going to go ahead and stain Finn's ear slide that we've made. So we have our stains here, so we're going to be holding each one for about 12 seconds. So go ahead and count. Okay, so the first one you don't need to rinse, but after each one of these ones here, we will have to rinse after those 12 seconds. Okay, go ahead and rinse with our distilled water here. Okay, our last one. And after that, we're going to be using our fibulous paper here to help dry it. That way we can go evaluate it. Okay. So that is how you stain your slide. Okay. Move on. Gingerly tap the paper to dry, and so the stain is going to any kind of material, so you can't really see it, but microscopically things like yeast and ear material will pick up the stain, so we'll be able to go ahead and look at it underneath the microscope. And so how to read at a microscope, you'll be going back and forth, never looking at the same place twice, and you'll do that in this kind of formation, going back and forth. So we'll start over the very edge of our side and focus in on each power all the way. Alrighty. Focus. Okay. Now that we have focused, we're going to go ahead, go down, and with ear slides to help focus things can go ahead and add some oil. And so far everything looks normal. And that is how you do an ear cytology. Now I'm going to be showing how to collect for a fungal test. What you'll need for this is some hemostats, an area to clean the area that you're going to be pulling the hairs from, and then some DTM to place those hairs, the hair roots and stuff like that, in and let them incubate. So this is Markel, this is Finn. Markel's going to help restrain Finn. Where you want to pull out with the hemostats is right at the very, very base of the hair. Any skin flakes or anything like that's going to be really helpful and make it more accurate for your fungal test. What you want to be looking for when a patient comes in is skin lesions, balding, scratching, biting, itching, any kind of sign of itching or irritants going on with your patient. In particular, one really common one is ringworm. So where you want to collect for things like ringworm or any other kind of fungal infection is on the outside, the peripheral of that site. So without further ado, I'm going to find a spot, clean it ever so lightly. And this piece of gauze has some sterile saline on it. And then I'm going to grab from the very base of the hair, click it, and pull. Good boy, Finn. Now I'm going to place it very gently. So you kind of want some of it to be in your DTM, just like so, so that it can grow. And then you're going to put the lid on and screw it about one time just to make sure it doesn't fall off. You want it to have air in it so that if there's any sign of fungal infection or anything like that, they'll have some air to breathe and live and thrive and grow. And then we'll place this in a dark area and we'll wait for 10 days and we'll have our result. So now that our DTM tube for Finn's fungal test has been sitting, we are now going to evaluate it. If it were to have changed color, so far the DTM hasn't changed any color, so it's not looking like there's much fungus present at all. But what we're going to do to confirm this, I'm going to go ahead and take some sample from the area. We'll go ahead and place it on our tape here. Okay. And then we're going to add some methylene blue here to do our wet prep. Add a drop. There, just like so. And then we're going to add it to our slide. Alright, now our wet prep is complete. We're going to head and open it up. And so, even though with the naked eye it doesn't look like we had grabbed much, there's lots of matter on here from the DTM and from Finn's fur. So far it's not looking like he has anything, but if he did have some fungus present, it would be lit up blue from the new methylene blue. But after the evaluation of going back and forth, making sure I haven't looked at anything twice, it looks like Finn is negative for any fungus infection. Alright, so now I'm going to be doing skin scrapings. When you want to do skin scraping is if a dog comes in or a cat comes in, scratching, hair loss, some kind of like lesions on their body, biting at that place or anything like that, that's when you would want to do your skin scraping. Where you'd want to do the skin scraping is in that area where it's the most effective, just in case you know, those mites or anything like that is living in there. That's where they're going to be at, is where it's most inflamed, not on the outsides. How deeply you want to go, you pretty much want to go all the way up until you see some capillaries break, so like red blood cells and things like that. Not making the patient bleed or anything like that, but just so that you can get some of those, because that's when you're going to be getting the Demodex and Sarcoptes, which are pretty deep in there. So without further ado, you'll need your scalpel blade, your mineral oil, and your slide. To help prep your slide and your blade, put some mineral oil on the slide. Take your blade and tap it ever so lightly. And then, this is Markel, she's helping me restrain, and this is Finn. So we'll go to this spot, and parallel to the skin, you can also pinch the skin, but for now we're just going to go straight across until we get some capillary bleeds. So you do this until you see any capillary bleed, which now you're seeing some. So now we'll go over to the slide and we'll tap it on there to make sure. Now that we have our skin scraping all ready, I'm going to go ahead and view it microscopically. So since Finn didn't necessarily have any symptoms, I'm going to be looking at this and taking a look. What you should expect to see at least is those red blood cells that I was talking about that we purposely got up to make sure that we knew that we were getting deep enough to get those Sarcoptes and also those Demodex. So we've seen it before, we've seen Demodex, but we'll go ahead and take a look just to make sure that Finn does not have any. And we'll continue on with each power, just like so, and move it. And you'll want to do the back and forth, not making sure that you're not going to any spot twice. Complete. So far everything looks good. See a couple of red blood cells. Okay. Other than that, everything's normal, and no Demodex or other skin mites are present, and that's how you do skin scraping. Okay, so we're going to be demonstrating how to do a necropsy. I have Dr. Davis here, my preceptor. What you will need for a necropsy is protective wear. I have a bouffant cap, I have a mask, she has a mask as well, gloves, and a gown. For more contagious diseases, we would have a shield over our eyes, but since this is just a shelter catch and no known diseases, we don't need that today. You'll also need tools for your doctor, and then also your jar is full of formalin liquid. And I'll let Dr. Davis take over.
Alright, so we'll do an external exam initially to see what kind of condition the cat is in, see if you can find any clues to what you need. Her general hair coat is kind of unkempt. She has a little bit of tartar on her teeth, not a lot. She is missing the part of the left front leg from about mid-humerus down. She's also missing part of her right hind leg from about the hock down. So she's essentially a two-legged cat. No external parasites are seen, so we will go and do a ventral midline incision. I might have you help hold her just a little bit so she doesn't move. Get into the abdominal cavity, and then we'll elongate our incision with scissors. Different pair here, a little bit heavier. And go up as far as you can to totally be able to see into the abdominal cavity. Puncture through the linea. well. And we'll start examining the internal organs here. Alright, so right off the bat we have the intestines, and just on initial brief exam they look pretty healthy. Most of the time you're going to want to run the whole bowel and see if there's obstructions, neoplasia, that kind of thing. But since we have time limitations, we might not run the whole bowel. The spleen is a little bit on the small side. Here is the urinary bladder. And kidneys. Kidneys look pretty decent. They're of normal shape and size. No irregularities on that. You can see a limb of our pancreas here. And then over on this other side we should be able to find the other part of the pancreas. Right here. And here's her liver. And her liver lobes overall look pretty good. They're not, don't have any lumps. They aren't enlarged. Not discolored at all. Her other kidney right here looks pretty good. She's intact. You can see the uterus and ovaries right here. Gallbladder is somewhat enlarged, but it's not overly distended. And her stomach is right up here. Seems to be partially full of ingesta. So overall the internal organs for the most part look pretty decent, and colon going down. We're not seeing any significant abnormalities. In this particular case I am going to take a sample of the liver and a sample of the spleen so we can just potentially submit it if we were going to. Since we aren't worried about hemorrhage so much anymore, I'm just going to use some scissors to take off a small wedge and use very gentle handling technique. You don't want to crush it. So we have our piece of liver, and I will also take a piece of this smaller spleen. In a real necropsy, you'd want to take samples from any questionable organs, sometimes every organ if necessary. So that completes our brief necropsy here. I'll hand it over to Katie.
Okay. All right, so I'm going to be putting our samples into separate test tubes now. With these are jars. For necropsies, you want to make sure that you have a screw-on cap full of formalin liquid so that you can send it out to whoever, or if you do your testing at your clinic, that's where you'd want to keep it. All right, so with the first one, very careful, want to place it into the jar and screw on the cap. Now if we were going to be sending these in, we'd want to make sure that we kept these separate as they look similar. So I'm going to put this one over to the side. And then for our second sample, place it as well. Screw on the cap. Alright, so with our two samples, what we would do if we were going to be sending these out, we would date each one, and then we'd do the patient name. This kiddo unfortunately does not have a patient name, it's just a feral kitty. So we would put a patient name, date of birth, ID number, so that'd be like our hospital number, what have you, and then the specimen source. So we'd put where each of these specimens came from, and then we would send it out. So this is how you get your samples collected, put together, and assist your doctor in a necropsy. Now she's going to be suturing this kitty up, and that's how you assist with a necropsy. Now I'll be discussing rabies preparation. So for our state of Montana, what the person who is allowed to handle is a designated rabies technician. So someone who is frequently gets the rabies vaccine and things like that. So specific people who are trained in how to handle rabies suspects and how to do rabies preparation. the protective gear that you'll need is the full personal protective equipment, mask, eye covers, gloves, gowns, and things like that. The specimen is, if it's under 5 pounds, you can send the whole body, but if it's over 5 pounds, the brain tissue is what you'll be needing, so the patient will need to be decapitated, and then the specimen will be placed into a box, a styrofoam box, to keep it insulated, and then a box itself, and then submitted to the state lab and shipped that way. The remainder of the body is placed separately and double bagged in case of any contamination, and then the state will come by, state animal control will come by, and they will dispose of it from there. And that is rabies preparation. Now I'm going to be showing how to do vaginal cytology. So what we want to do is make sure that we prep the vulva sterilely. So I've got some chlorhexidine and some sterile saline to help wash. So I'm first going to scrub around her vulva. This is Markel. She's helping me restrain. She's my coworker. And then this is Dr. Davis, my preceptor, trying to make this fear-free. So I'll lift up the tail. Her vulva is down here. So luckily she has a pretty short tail, so I'm going to scrub. Just to make sure that we don't get any other cells on the swab. Now, and Dr. Davis, if you can hold the tail. Thank you.
Here we go.
So we want to make sure that the tail does not touch back on the vulva. And I'm going to rinse a little bit. Okay. And now I'm going to grab my sterile swabs. Sterile swab. Now I'm going to lubricate the swab with my sterile saline. I'm going to grab my slide. Now I've already written on my slide Gertie, vaginal cytology. Alrighty. So go ahead. Alright, and so you want to insert the swab going up first, and then once it goes up, you'll feel it flatten out. We'll grab those cells. Alright, good Gertie. So now that we have the sample, we're going to roll it onto the slide. Just like so, so that we have those cells. And now we are going to stain it. Okay, so now we are going to go ahead and prepare Gertie's vaginal cytology. It has been set, so we're going to go ahead and start staining. So the first one we will not need to rinse afterwards, but these two we will. We're going to be holding them in this the blood stain. So this one is specifically set for cells because we want to see cells. So for each one we're going to let them sit for about 12 seconds. Okay, to our second one. Okay, we will go ahead and rinse the slide. Nice and thoroughly. Okay. And after this, we're going to go ahead and take a look underneath the microscope. By first drying our slide with our bibulous paper. Okay, go ahead and rinse it again. And then we're going to determine, based off of the cells that you'll see present, which stage of estrus Gertie is in. So Gertie, keep in mind, she is still a puppy, but she is starting to get to that possible range of possibly going into heat. So it'll be interesting to see what we find. So go ahead and dry off our slide. You can see that we have some cells present. We'll go ahead and take a look. Okay. There's our cells there. A nice good cluster to focus in at. Okay. Alright, so based off of these cells here, looks as though Gertie is in an estrus. So there's no superficial cells, it's mostly intermediate cells. She's also not showing any signs of being in heat. So I'll continue to go on the estrus cycle. So from then on, you know, as she gets older, she may go into her first heat where she's going to go into proestrus. So she'll show clinical signs of red vaginal discharge. So her blood vessels are kind of breaking and things like that. And so those cells, they'll shift from the intermediate cells, like what they are now, into superficial cells. And then from there, she'll go into estrus. And so all those cells are now going to be cornified. And then also what you could possibly see on your microscope is semen, because clinically they will be accepting males at that time. Then after that, they'll go into diestrus. The superficial cells, no more cornification, they'll all be decreasing greatly, and then you'll start seeing those intermediate cells again. And at that point, they'll no longer be accepting males and, you know, no longer showing any clinical signs of being in heat. And that's how you do a vaginal cytology. For the last segment of my Pathology 2 video, I am going to be doing the cross-match agglutination test. And so I have already drawn blood on my two patients, Duck and Dunn. Both of these are one of my coworkers' dogs, and I have my purple EDTA tubes that are marked with their names and recipient and donor, and then I have my serum separator tubes marked as recipient and donor with my patient's names. So first things first, we're going to go ahead and centrifuge both of them at 3,000 RPM for 10 minutes. So go ahead and place them opposite of each other so that they are going to be properly set. Now that our blood samples have been centrifuged, I am now going to take my clotted blood, the serum here, so you see the serum separator. We're now going to take that serum and place it into a non-additive red top tube. So Duck, my recipient, is going to go to Duck R. And I will place that aside, and I will do the same for Dunn's. blood as well. Now I'm going to go ahead and decant the serum from our EDTA tubes that have been spun down. So go ahead and remove that. Okay, now, and this is for duck's blood, so I'll go ahead and do that for Dunn's as well. So now that the serum is decanted off from our EDTA tubes, I'm going to go ahead and add 2 drops of our clotted, or packed red blood cells, and add 2 drops into our vial here. And then, making sure to be very careful that we still have duck, our recipient, placing into duck, our vial. And I'm going to go ahead and fill the rest of it up with saline. And then I'm going to centrifuge it for 1 minute at 3,400 RPM. And go from there. Get those cells nice and washed. And I'm doing the same thing for Dunn's. I'm going to add 2 drops of his blood here. And fill the remaining of the vial with saline. And I'm going to gently invert them and go ahead and centrifuge them. Now that both of our blood samples have been centrifuged, you'll see the cells at the bottom there. Now they're just slowly getting washed, and then you see the rest of the saline at the top. So I'm going to dump out the saline, and then I'm going to do the same thing that I did before, where I fill the rest of the tubes up with saline and centrifuge them for 1 minute at 3,400 RPM. And I'm going to do that twice, and that'll get them nice and washed, and then we'll get to where we're going to place them into their final vial, where they're finally washed.
Okay.
Now that I've done the final washing, I have poured the rest of the saline off, and I have grabbed 0.02 mils of the washed erythrocytes. And so now I'm going to make a 2% erythrocyte suspension. So for both kiddos, so this one is Dunn, which is my donor. So I'm going to go ahead and insert that 0.02 amount, and I'm going to add my saline of 0.98 mils into the solution, and I'm going to do the same for duck. Now I'm going to be doing the major cross match, so I'm going to take 2 drops of the of my donor, so Dunn's erythrocyte suspension that I did, and mix it with the 2 drops of his of the recipient's serum, which is duck's. So I have the I have Dunn's suspension. I'm going to go ahead and add 2 drops into a new test tube here of the suspension. And then take 2 drops of Dunn's serum, of duck serum, my recipient. I'll go ahead and add that to my new test tube. Now I'm going to be doing my minor cross-matching. So I'm going to go ahead and take 2 drops of my donor, which is Dunn's serum, and place it into a new test tube. And then I'm going to take 2 drops of my erythrocyte suspension from my recipient, who is Duck. So I'll go ahead and take 2 drops and place it into my new tube of my donor's serum. And then take 2 drops of my suspension. Okay, and then now we're going to go ahead and let those incubate at room temperature for 30 minutes. So to check for agglutination, auto-agglutination, I'm going to go ahead and make a control group for both of my patients, so for Dunn and Duck. So I have my vials here, and what I'm going to do is going to add 2 drops of the solution, the erythrocyte solution that we made earlier, and mix it with their own serum. So I'll go ahead and add 2 drops there. And then, so this is Dunn's, so I'm going to add Dunn's own serum back to the washed red blood cells. So add, okay. And then we're also going to let those incubate at room temperature for 30 minutes. So I'll do the same thing for Duck's blood. So now it's been 30 minutes of our major and minor and control groups incubating for 30 minutes. So I'm going to go ahead and I'm going to centrifuge them for 1 minute at 3,400 RPM. Now for our final steps, I have centrifuged both the control groups and the minor and major tests. It's not looking like there's any hemolysis present, and then also looking like there is some present there, but we will really see. So we'll set our control groups down, and we'll go ahead and to shake both our major and our minor test tubes, we'll kind of tap it gently for both of them. All right. And so what we're looking for is for any agglutination, some visible with the naked eye agglutination. And with our minor test group, it doesn't really look like there's any agglutination visible to the present eye, but with our major test group, it looks like we possibly could. So what I'm going to do now is I'm going to go ahead and put them underneath the microscope and take a look at them and see what's going on underneath. So I've placed a drop of my major test solution onto my slide, so I'm going to go ahead and take a look at it at my lowest power so far. And I'll slowly focus in. And you want to make sure that you can decipher between the rouleau versus agglutination. Under further power, and this is why you want to double check, it does not appear any agglutination is present. So it looks like our donor is a good donor for our recipient. And then I'm going to go ahead and check my minor. Okay, so with our minor, we're going to go ahead, I placed a drop, and we're going to go and check our minor test here. So what you're looking for with both of these I haven't really explained it before, is that you don't want the erythrocytes to be in grape-like clusters. You want them to be evenly dispersed. And that's the agglutination. And you don't want to confuse it with rouleau, because rouleau could also look that way, except in a line. So you can definitely tell the difference, but you just want to make sure that you're not accidentally misreading it. And it looks as though the minor test is also evenly dispersed. There's no grape-like clusters, and looks like these two can be matched with each other. And that is how you do manual cross-matching.